I think we'll get started. I don't know how many of you have just been on the major session, but this session will last 40 minutes. We're not cutting that back. The only thing that will be cut is the rapporteurs will have to summarize in 3 minutes rather than in 5 minutes that was the original schedule. So welcome to the breakout on nutrition and health equity. And we're here to talk about how nutrition and health equity will play a role in reimagining the food systems. What we're going to do during this session is I'll ask each of the speakers to very briefly introduce themselves. I'll ask the two rapporteurs just to say hello and tell us who you are and where you are. Perhaps the rapporteurs would like to do that now.
Hello, yeah, I'm Catherine Schilling. I'm currently in the UK, but I'm a research associate scientist at Columbia. I'm an isotope geochemist, so working in Alex Halliday's group, and I'm focusing my research focus on looking at like pollutants and nutrient cycles from the soil to the plant.
Okay, and Corey.
Hi, I'm Corey Lusk. I'm a fourth-year PhD student in the Department of Earth and Environmental Science here at Columbia. My thesis work is mostly on how weather variability affects crop yields, major crop yields globally. Subtler aspects like rainfall intensity and land-atmosphere coupling and stuff like that. But I've also worked on weather and natural ecosystems, and also shifting into more mitigation and adaptation questions, so all over the place.
Okay, and so I'll introduce myself. I'm Richard Deckelbaum. I'm the past director of the Institute of Human Nutrition, and I'm a member of the departments of pediatrics and epidemiology. I do both international global health and basic science research. And the format of today's session is what we're going to do is we're going to start out with 3 case studies. Okay, and the first 2 will be on sort of international or global problems that are related to nutrition and health equity. And then I'll give a short one on local nutrition and health equity. I'll present the case study of Harlem and Northern Manhattan. So with that, we're going to get started. The first case study is going to be given by Louis. Louis, briefly introduce yourself and give us your case study.
Yeah, I'm Lou Ziska. I'm an associate professor in environmental health sciences at the Mailman School. I'll try to make this short and hopefully to the point, because we'd like to hear from all of you in terms of what you think. I've been involved for a number of years in looking at the role of rising carbon dioxide on rice. And there's good evidence to date that both recent changes and future changes have had a profound effect in terms of lowering rice protein, changing elemental analysis such as iron and zinc, and also changing the vitamin components. In one case, we saw vitamin E tends to go up. In other, the B vitamins tend to go down. Imposing this in terms of rice, which is a globally consumed cereal, is really interesting. And using FAO food sheets gives you at least a glimpse of this. When you look at it from an economic perspective, what we find is that the poorer countries in Asia, particularly Laos, Indonesia, Bangladesh, consume at least 50% of their daily calories come from rice. So any CO2 imposed limitation on that is going to more adversely affect them than it is going to affect other countries where economic transition is occurring. So 50 years ago, for example, if you look at consumption in China, you find it's fairly high, on the order of 60 to 70%. Well, now it's down to 20 or 30%. As they change economically, the diversity of the diet changes such that they're less susceptible to these kinds of CO2-induced vulnerabilities and nutritional integrity. So how do we then begin to address this? How do we begin to put some sort of fairness into this equation? So we'd like to hear from some of you about how do we begin to solve some of these issues.
Oh, Richard, you're muted.
Can't remember where my voice is. Okay, well, and what we'll do is we'll save comments on the case studies, and we'll for a bit later when we get into the questions, and we'll try to focus how we address these different points that are coming up in the case studies through the questions that are coming up soon that some of you heard about already in the larger plenary meeting. Shauna, will you give us your case study, please?
Yeah. Hi, everyone. My name is Shauna Downs. I'm an assistant professor at the Rutgers School of Public Health. For my case study, I'm just going to talk very briefly about some of the women that I work with in Nairobi. So I'm doing research into informal settlements in Nairobi, mostly with women, and trying to understand what drives their food choices. And these women tend to have really high levels of malnutrition, both in terms of undernutrition and micronutrient deficiencies, but also overweight and obesity. So you see both forms of malnutrition in the same households and within the same women sometimes. And in terms of food choices, price and affordability food is the main driver of food choices. And while these women often know what a healthy diet looks like and they're able to really articulate it well, they're not able to purchase those foods for a variety of reasons, often very much linked to social determinants of health and looking more upstream at some of the basic drivers of malnutrition. So things like working in the informal labor sector as an example. So oftentimes these women are working on a daily basis to earn money that they can then use to buy foods for that given day. And so then the next day they start all over again, trying to earn money to be able to buy foods for the following day. So this creates obviously a lot of inequity in terms of dietary quality, but also in terms of malnutrition. So what are some of the ways that we can address this, knowing that there's all these structural issues that are affecting nutrition outcomes amongst that population?
Thank you, Shauna. And just I'll just say that I've spent most of my time working internationally in Africa and Middle East and problems of the double burden. And I must admit, I've learned a lot in the last few months, couple of months, largely with inputs from Jennifer. So, those of you who heard a terrific talk in the plenary session of what's going on in terms of, I would say, nutrition inequities, health inequities in our neighborhood in Manhattan. And I'm just going to focus really about, where we are, our neighborhoods, which are Harlem and Northern Manhattan. So we know we've heard a lot about the double burden and different settings, but it's really striking how it's here. It's here in our neighborhood. And well, you see when you're just going on the subway in Northern Manhattan or whatever, we see there's a lot of obesity, adults and childhood obesity. But at the same time, we have a very, very heavy burden of, let's say, food insecurity, hunger, and this actually varies in the Manhattan region from 12 to 40%. We have big problems in terms of differences in premature death rates, which vary, let's say, 57% at 125th Street, and then we move up to 180th Street, and they're 70% of the population has early deaths. We have poor diets on both the under and overnutrition side, And we have a major problem in Manhattan with the non-communicable diseases. And here again, we have major disparities in terms of the non-communicable diseases, where we have a much heavier burden on the Black and Latino populations. We know that the non-communicable diseases, obesity, overweight, are closely associated with increased risk of bad outcomes, mortality from COVID-19, where the Black and Latino communities have twice the death rates of the Caucasian population. And one thing I'd like to bring in, because I do basic science, as we go from 125th to 180th Streets, we go from a Black to Latino population. What part may genomics play here in contributing to some of these differences? Is it all social, economic differences, or how do these interplay with genomic differences? And with that, we'll now move on to the questions on how the different topics that we've just addressed might be interfaced with the questions that are posed. And we've decided that among us, Shauna is going to lead us in a discussion on the first question. So Shauna, would you like to take it away and phrase the question again?
Yep, so there's 3 questions that we're going to go through over the course of the next 30 minutes or so. So the first one is, what are the barriers to effective change and what actions should be taken to overcome them? So again, what are the barriers to effective change and what actions need to be taken to overcome them? Anyone want to take the lead? I guess I can start by throwing out a few. I think in terms of the barriers to effective change, I think some of the problems are that, you know, they're very structural and systemic, and I don't think it's always clear how to address those. And so that can create challenges, I think, in terms of coming up with the best solutions. That's not to say that we can't find solutions. I just think that that can sometimes be more difficult. Any comments related to that?
Can you say more about what you mean by structural?
Yeah, so I mean, Jen, we've talked about this in on other calls, but you've mentioned in the past redlining as one example, and you know, creating huge inequity that's, you know, not necessarily directly influencing food security, but through indirect ways it does. And so I think often it's easier to find solutions that are the direct pathway is very explicit. So X causes Y. But when we think about nutrition, I think that there's all these factors at play that could be related to housing, access to clean water, access to sanitation, you know, a variety of different things. So that's kind of along the lines of what I was thinking.
I think one of the, you know, something else I was thinking about is just like the role of money. And, you know, when you think globally, the people who have money are the people who are in power. And if someone is in power and they want to, you know, stay there, how do we encourage them to, you know, whether it's a country or a business, how do we encourage them to, you know, care? So like when Lou was talking about the example of rice in Asia and the economy changing and how there's a interaction, you know, I think when you think globally, who's contributing the most to whether it's emissions or unhealthy nutritional products, like ultra processed foods that are being, you know, spread out, like how do we kind of govern that, and why, why would anyone care who, is benefiting from these, kind of the imbalance of power?
Mhm.
Right. I mean, I think that's a really good point. And as someone who does some work in food policy, there's so many examples of where someone in power, or whether it be lobbyists or what have you, are able to really influence our ability to come up with solutions, whether that be through World Trade Organization or other mechanisms. I mean, obviously there's often, for the policies that I think would be the most effective, there's more and more persistence from those in power or with who wield the power to try and thwart them, essentially.
Shauna,
Sorry, go ahead.
Go ahead, Jennifer.
I was just saying, I mean, what do there's a few other people on the call, kind of interesting, like, what do you, think about when you hear these things? Like, what ideas do you have about how we could kind of overcome these barriers?
Let me give 2 examples. So I was on the United States Dietary Guidelines Committee a few years ago. I won't say what year, but it was a number of years ago. And the night before the final guidelines were going to be released, we had a meeting where we were told that the Department of Agriculture, was going to pull out if we included the word free sugar in the guidelines. And that came from, I'm not sure quite where, but there was obviously some lobbying that afternoon. I mean, that's a true story. And we know this exists in WHO with power. And when they, after the tobacco, guidelines were released, and they tried to release food guidelines, there was huge political interference. Here's another example. So if we look at corn prices in the United States from the last century, it's been a huge decrease in the cost of corn in the United States. Right? And that's because of subsidies and government aid to corn farmers. So it's really low. The United States requires, in cattle in the United States for beef, for every pound of beef, you need 14 pounds of corn feed. And corn is cheap. So what does that mean? It essentially means that the American taxpayer is paying for McDonald's super meals. That's what it means, or the dollar menu, because it's so cheap, because of government support for corn over the last few decades. I think those are just 2 examples. And that's very political, that government support of corn.
So, I mean, what I'm kind of hearing there is this, and I feel it's something I've been running up against, is a lack of transparency on how and where our food comes from.
Yeah.
So if people understood, maybe that would allow, choice, or if people saw, how far their food was coming from, or, why it was coming from wherever it was coming from, could that create some sort of, and Maria was talking about social movements.
Yeah.
Do people care?
Mm-hmm.
I'd like to just add quickly to the corn example. We did a study wondering why corn was the principal biofuel, when if you do any kind of analysis of it, you find that it takes almost as much energy to grow corn as you get out of it. It's almost a 1-to-1 affair. So we looked at things like sweet potato, we looked at things like cassava, we looked at other things, and they're much more efficient. But unfortunately, there's not a sweet potato lobby in Washington. There's a very strong corn lobby in Washington. There's a very strong political influence in terms of Midwestern states and the Iowa caucuses and who is going to be supporting corn, and on and on. It makes it very difficult to enforce these kinds of changes that are good for you when the system is set up to reject those changes.
Yeah.
That being said, there are community efforts. I work with a group called the Clementine Collective on Staten Island. And what they're trying to do is to they're taking boxes of fruit to the corner stores, to these food deserts, and then basically putting them there. Now the store owners have said, "Oh no, no one will buy these. These are, these are not things that they're not processed. People don't like them." Well, you put out a box of clementines and they're gone in 30 minutes. I think people recognize that these are good foods that they simply don't have access to. So, and this is a very cheap way of trying to balance diets, to provide these kinds of additional fruits and vegetables. Admittedly, spinach doesn't go as quickly as clementines, but you can put out all of these different fruits that are appealing to people, and they will buy them. They will purchase them.
Right.
And it would be really interesting from an epidemiological point of view to begin to sort of look at how these kinds of grassroots, low-level kinds of initiatives can scale up, because at the moment, because of the current state of politics, nothing is going to come from the top down. All of these initiatives, all of these changes are going to have to come from the bottom up. And there are a lot of really good ideas and ways to try and achieve this. So I think there's hope, but we obviously, in terms of trying to influence the sort of nutritional breadth of that we need in order to ensure good public health. Another way is looking at it from the insurance industry. They have to pay money out of their own pockets for this. Is there a way of convincing the insurance industry that it's to their benefit to have incentives for promoting, let's say, the iron content of rice in places like Bangladesh? Or another way, Bangladeshis tend to cook their rice by parboiling it. By parboiling rice, you tend to ensure that some of those nutrients are still maintained as opposed to polished rice. So there are ways of adapting, ways that are fairly straightforward, that don't require a lot of funding, but maybe some cultural changes that could be implemented. And sorry, that's my 2 cents. But
yeah.
Thanks, Lou. No,
Okay.
that's great.
I have one comment, sorry.
Okay.
Shouldn't we also stop like that we can patent certain crop species from multinational companies, patent that they have crop species, and that should be banned, because internationally these are just available for all, like in communities like in India, they have to buy it because they cannot use their breeds anymore, or they have to buy their fertilizer from the same company. Like the company has the hybrids, but also at the same time provides the fertilizer. That needs to be banned, that these multinational companies combine these two things.
So Catherine, as a rapporteur, could you report one of that back to the whole group after we get together? And we're just looking at the time, we're going to move on to the next question, where Lou's going to be leading the discussion. Do you have the question in front of you, Lou? If not, I can read it.
Well, basically, what they're asking for is, you want to know, how do we take the interdisciplinary research and practices? What specific is needed to advance the food system changes in your area? And this is a difficult one for me. I don't know how the rest of you feel, in part because as a scientist, sometimes you feel like, well, if I just did the right experiment and I just had the right PowerPoint slides, boy, I could convince anybody that this is a great idea and they need to do this. There's a lot of interdisciplinary work that needs to be done, but whether or not that work is implemented as a means to change the food system is more than just what happens on your end. But that being said, I'll offer one quick idea, and it's one I've said before. There has to be a better connection between what the plant people do and what the public health people do and what the medical people do. I've worked with Naomi Fukugawa for a number of years, and she has a very different, very interesting perspective in terms of diet and nutrition than I have as a plant scientist. And that's good. We often in academia are siloed. I'm sorry, I think the current Trump administration refers to them not as silos, but as cylinders of excellence. So I just wanted to clear that all up. But in any case, we need to breach those silos and to begin to look at, well, what are the health issues that we need to be concerned about? How can I put together studies and experiments that translate my academia into something that the average consumer will understand? We had an idea just before COVID of putting something together, what we call a carbon food print. So if I went to the store and I bought a pound of ground beef, it would give me what the carbon dioxide impact of that would be, or a CO2 equivalent impact of that would be, as opposed to if I bought a pound of protein that was plant-based, what would the carbon impact of that be? And by doing that, can we influence consumers to purchase something that has less of a CO2 signal? So if you buy a bag of chips that says 50% less fat, now it'll say 50% less, CO2 emissions or something like that. So there are ways to approach this. There are ways to try and make a difference. And I'd be really interested to see your guys' perspective on this. And what do you guys think?
It's a tricky question. What science ends up actually influencing things and how, and to what degree the scientists have any control over that at all. So for instance, we've seen planetary boundaries on several presentations today, and I'm sure throughout the conference. Why did that get picked up, and why is that influential? It's clear, but there's lots of clear research, right? Not an answer to the question, but
No, it's a perspective, and I agree with you. Often, after I graduated with my doctorate, I felt, I just had to say, do the right research, and it would all come true. But there's a long, there's a pathway you have to follow. How do you guys feel about communication, for example? How can we improve our ability to communicate the results of our studies to practical results? Meridel, how do you feel about that?
I mean, I think that's a kind of a perfect way to say it. I'm very glad that I do more of the science and not the behavioral predicting how people will pick up on different, incentives and things like that. It's much harder to predict. In some ways, I know people do behavioral models and other things like that. And I mean, my experience is pretty limited in terms of I do a lot of more of the hard data, more of the inputs, outputs, and not the more, implementation side of things. But it's interesting. And if there's a way to maybe set up kind of a network of models or a network of, the potential food security or nutrition security outputs that you get from a model into perhaps a behavioral pathway. I think that would be really interesting, but I'm not entirely sure how to do that.
I just wonder about, the potential role of even the private sector benefit, providing benefit here. So I work in cardiovascular diseases and prevention and basic research. And if you look at cholesterol, high cholesterol levels, it was known for a long time that high cholesterol levels are a risk factor for heart disease. But but you couldn't really people didn't feel high cholesterols, and they didn't realize it. And I'll tell you when the difference came out, it's when statins were discovered to be effective in lowering cholesterol and decreasing cardiovascular disease. That was the change. And so that was a different type of change. Now we have obesity, for example. You can see obesity, and people know about obesity and they're hearing it. But how do we integrate now the behavioral, dietary, lifestyle changes that are going to be needed to combat that? Do we need the private sector, or can we do it through community actions? Or, as Jennifer said earlier, how do we get the bottom-up approach when, 40% or 50% of that population is part of the problem?
I guess I would argue that you need all of those things, which makes it more complicated. But I think, going back to one of Lou's earlier comments about local solutions, I think that's potentially some way that makes it easier, or at least that you can get some, early wins. One thing I was thinking in terms of the interdisciplinary component to it, I think part of it is related to training. And so if our teaching allows for more interdisciplinary programs, I think that it allows them for the students to think about problems in a more interdisciplinary way, and then potentially the solutions they come up with to some of the problems that we're facing are more innovative and cross different disciplines.
I don't know if it's okay to chime in, but I've been having several thoughts in this conversation. It's really fascinating. And on that note of interdisciplinary, one of the questions I keep coming back to is, who do we want to change, or who do we need to change their behavior? And I think at the individual agent level in clinical medicine and public health, we think about theories of behavior change. And from an economics perspective, we think about, okay, well, is it affordable? Is it there? Is it available? What are the prices? Do people have the income and resources to purchase the healthy diet we want them to purchase? And then, I think at the policy level, I'm asking, what have our policy priorities been, or what do the existing sets of things that we do and don't fund and incentivize say about what our values are? And the private sector has a whole lot of vested interests. I think that's clear. And what we really need are governments to change the rules of the game for the private sector. And when we think about, okay, well, what do we know from science, or the various domains of social science, because I don't know anything about biological science, what can those tell us? And I think, from policy, political science, economics, we have some frameworks about, okay, how do you get civil society to call for government change? How do you use democratic processes? And then in public health, we have these theories of behavior change. I think in sociology, we have ideas around social norms, which can change cultural preferences and group practices. And how do we bring all of those frameworks together to think about a coordinated strategy that influences all of those various stakeholders to change their behavior? Because we need them all to respond differently in some ways, right? Like the desired behavior from each of those actors is somewhat different, but if they only did it each in isolation using one strategy, we wouldn't get this massive shift that we need. So I don't have an answer, but I certainly am seeing a role to be hearing from different disciplines who have an understanding of how you change those different groups' behavior.
So we have a lot of things that we're trying to squeeze into a limited time period. And so we don't have that, we have about 5 minutes left. And these are all critical points. And I hope that even though we might summarize them in a post-meeting report, because we even won't be able to get them through in the 3-minute time to report on our meeting. But I have my question is, what actions should comprise the first steps in reimagining? And one thing I think I'm learning is that it can't be just out of academic medical centers, or we're not going to do it. A few years ago, I was at a conference with a fellow, Sam Gidding, and I said, Sam, you and I have been talking about pediatric obesity for 10 years or 15 years. In the meantime, while we're talking, it's doubled in the States. So how, Jennifer, I'll ask you, how do we get out of the medical center and get that bottoms up approach of the community to really take action? And then when they're going to take action, how do we get the governments and people who set policies to listen? How do we do that?
I mean, I think what I appreciate what you're asking, and also what Kate just said about all of the various perspectives. I think I mentioned it in my talk too. Like what I think we can do more of is having like a core set of measurements that can be applied to various research questions in ongoing studies. So for example, I, in my intervention work, have no clue what data I can collect to provide variables that might be needed for a climate scientist to estimate, you know, how whatever dietary change I'm working on might influence the environment. And so, you know, having kind of a core set of measures so that we can really, I guess, expand, you know, the way that one study can be used in for various different, you know, stakeholders could be a kind of quick first step. But I also feel like we all, you know, there's no like disagreement that we need to shift to more of a fruit and vegetable type of nutrition. And so, you know, to me that just is a clear, you know, goal that needs to be achieved. I think the main barriers we know are cost.
Right. Other actions that I think we could use.
I think we have to fund civil society. A lot of the like where the hope resides in a lot of these things is very grassroots, local stuff. People working in the evenings after their day jobs, trying to fight for policy influence against people who draw six-figure salaries to do this full time with a huge team for big companies. As long as that's the situation, I think it's going to remain very asymmetric. I don't see why, you know, there isn't a mass public fund for civil society, for these groups, that they're entitled to public resources to compete against private resources for influence.
Yeah, you know, the other thing we could do in terms of actions, and what Jennifer was just talking about, and we've had some meetings at Columbia and actually at the Food and Nutrition Board of the National Academies of Science, and how do we get integrated metrics so that the food and nutrition metrics can be integrated with the agricultural and climate change. And there's a real need for that kind of integration between these, I guess, whatever we're calling them, silos, or we have to integrate the metrics so that the climate statistics feed into the nutrition and food statistics and feed into the, you know, how do we bring the, I guess the triangle we're talking about is, let's say, nutrition and food, agriculture, climate. How do we get them to the databases to talk to each other?
I think one of the things we need to refocus on is, and don't mistake this, but I think we need to get rid of polar bears. I like the EDF and all of the emphasis on polar bears starving on the ice, and I'm very sympathetic to that. But if we can make it so that it's clear that if you're concerned about climate change, you should be concerned about your health. You should be concerned about your nutrition. Human beings, by and far, for the most part, are very selfish beasts. If they talk about polar bears, talk about the ice caps, that's very abstract. But if you start talking about it in terms of your nutrition, in terms of your personal health, you will make significant inroads in trying to convert the public into caring about these issues. And I think that's one of the things that, as environmentalists, as scientists, we don't always recognize that ability that you have to connect it to someone personal in a way that they understand and can relate to.
I think that's an important point. Make it personal. And I think we're a little over now. I see on my screen we're more than a minute over. We have to get back to the main session. So everyone should join in. I just want to say thanks to everyone for a robust, rich session. And I hope the rapporteurs took excellent notes because so many terrific points were brought up, and want to thank everyone. So let's all now move back to the plenary session of the meeting. Thanks for joining here.